Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurvich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Welcome back, Turd Nerds. We're so happy you're here. This is a part 2 of a 2-part series covering all things heartburn, GERD, acid reflux, all of that. Be sure to check out our previous episode where we cover lifestyle interventions and drugs. Lots of great things we want to know about for our patients. But today, maybe even more exciting, we are going to be doing all of our great herbal and supplement interventions. And this is one I can't wait to pick Dr. Gurvich's brain because she has presented on this quite a bit. So take it away.
Okay, so first of all, I was just listening to your intro, and I don't know if we've ever started this podcast without saying, guys, we're really pissed you're here. Like every time we start a podcast, it's like, we're so excited.
How dare you tune in?
How dare you tune in to our reflux lecture? So that's
I also think we're genuinely excited every time we get to come together.
Yeah, I always have a lot of questions for you guys, so it's a good time for me to get them all in.
You have questions?
I was diagnosed with insatiable curiosity at my residency graduation, putting it nicely, I guess.
You know what's going to be funny?
We are true nerds. True nerds.
I believe the trajectory of how this is going, that will actually be an ICD-10 code in the DSM.
Maybe.
By DSM-6, DSM-7, that because they were in the process of pathologizing everything, including insatiable curiosity.
I'd rather have that than a lot of options.
Or a lot of different conditions.
Yeah, whatever beefs up my complexity, right?
Yeah. So you can
for coding, for your doctor to code.
So you can higher.
More options for me. Anyway,
that is so sad and so true.
People.
Okay, so let's talk about. So the first thing I want to do is like this overarching theory of, is it GERD? Is it functional dyspepsia? Is it eosinophilic esophagitis? Like there's so many things that can go under that category. And so it's important to know that when you are looking at a GERD diagnosis, generally you need that to be validated by some kind of objective marker. And that is usually an endoscopy. So unless
no one actually uses, but we should.
I mean, they definitely do endoscopies, but we diagnose GERD for more people than just with an endoscopy.
Exactly.
Right. Sometimes it's clinical and we'll get an endoscopy if there's other concerning symptoms, but we do sometimes empirically treat if there's no alarm symptoms.
I will tell you that I often empirically treat, even if there are no alarm symptoms, because the reality of medicine, at least in my patient population, is to get in with a gastroenterologist is like, it just doesn't happen.
Right. So you can still start treatment even if there's red flags because it's going to be a while before you get in. I totally agree.
So the first thing I kind of want to talk about is there was this incredible article that was published by Lynn Patrick, who's a naturopath researcher. She's quite amazing. And it was published in the Alternative Medical Review. I feel like it was published, I'm looking right now, in 2011. Alternative Medicine Review published in 2011. This was a publication that was like gold, basically. If you can find old issues of it, it really is incredible. And it was a very well validated, very well respected alternative medicine journal that I think was published by Thorne. Is that right, Ami?
Is it no longer it's no longer published?
It's definitely not in hard format anymore.
Okay. And Dr. Patrick is known for environmental medicine. So I'm assuming you're going to talk about that and GERD?
Interestingly, I'm not.
Really?
Yeah,
okay.
Not in this paper.
Okay.
Dr. Patrick was a naturopathic physician who graduated from Bastyr in 1984. She is still working, and I think she's still at OHSU doing research.
Wait, oh, maybe we're talking about different, I feel like we're talking about different people.
Oh
Okay.
yeah?
Yeah, there's someone else I'm thinking of. So,
No, I don't know, because she also has a board in environmental medicine and medical toxicology.
okay, I thought she was in Colorado, but
Oh,
you know,
I don't know.
little
Yeah.
details we can sort through later. Why don't we talk about the article?
Okay, so the article was called "The Gastroesophageal Reflux Disease: A Review of Conventional and Alternative Medicine Treatments" from 2011. So it's definitely a little bit dated, but I will say that the majority of these treatments were still are used in my repertoire today. And so a couple of high level views, hiatal hernia can often cause reflux symptoms, obesity, metabolic syndrome, that, often those conditions travel together. And then the pharmaceuticals we talked about, we're always in our pharmaceutical or supplement management, we're looking at lower esophageal sphincter tone, we're looking at gastric emptying, we're looking at hyperacidity or hypoacidity. And I do want to, when you guys
Intra-abdominal pressure.
intra-abdominal pressure, we're looking at erosion or non-erosion. And will you just guys remind me to tell you about the couple of cases that I have at the end about using B vitamins to treat? Because that's really,
Okay.
really interesting.
And I also
You're
don't, I
leaving us on
wondered,
another cliffhanger.
I wonder if you two want to talk a little bit about you both have some techniques for determining if someone has a hiatal hernia that are, not necessarily accessible to the average trained practitioner. It's a little bit harder to just know if someone might have a hiatal hernia unless it's been incidentally found on an EGD or chest x-ray, or, it's not so easy to know that when you're differentiating, right? If someone has GERD or something like that. So I don't know if you want to talk a little bit about any of that.
Dr. Stan, you want to talk about your stuff? I think we visited it
We
briefly in the other,
did.
but I do think it's good to
Yeah.
repeat it. Dr. Stan, you
Yeah,
want
we
to talk
could
to us
refer
about
back.
So I tell my patients I'm not an imaging center, so I can't in any way tell or really diagnose. What I can tell is if there's an abnormal amount of like muscle hypertonicity, diaphragmatic hypertonicity, if the stomach is really bunched and I can't wiggle it, through visceral manipulation techniques at all. And that pressure, it is not going to help the lower esophageal sphincter stay put. It'll
Yep.
definitely push it up. And then so if people are symptomatic and I'm noticing a lot of the tension, why wouldn't we just create more space? And I do find, if it has been pre-diagnosed, people did catch it on imaging or they suspect it, we'll do the same thing. We'll create more space there.
And, from my perspective, I'm always doing palpation-based technique where I'm going along the costal margin. Generally, I'm feeling the left side. And my goal when I'm doing the adjustment is I'll kind of like sneak underneath the rib cage and try to develop traction on the top of the stomach and then try to traction it down in the form of an S. Sometimes the patients are like, whoa, that was crazy. And other times it's like a wah. But it's like, it takes a second to do. It's not comfortable, but it's also not very painful.
Yeah, sometimes it's like a thud, like it
Yeah.
almost thunks down, and sometimes you kind of have to like coax it. I do a lot of work on the diaphragm first sometimes to just see if I can loosen, because people carry so much tension in their diaphragm. Wow,
Yeah, it's a watershed. It's one of the three watersheds: the throat, the diaphragm, and the pelvis. That's where everything's going to get stuck.
Totally.
It sounds like a YouTube video waiting to happen right there with the technique.
If we ever
where we
launch
all
to
adjust each
YouTube,
other's stomachs. Love
if
it.
we ever move to YouTube, then absolutely we can do a demonstration.
That's terrific.
Okay, so why don't we start with some of our favorites, and then why don't we go from there?
Can we popcorn our favorites first?
Yes, and then we'll talk about them.
Okay, sure.
Okay, you go.
Zinc carnosine.
DGL.
D-limonene.
Is this like Jeopardy or like whoever gets the most in 30 seconds?
Glutamine.
N-acetylglucosamine's on my list. Baking soda water. Baking soda water.
Baking soda for sure is gross. Althea, marshmallow.
Trisalt
for sure.
sometimes.
What is it?
Trisalts sometimes, like the old Alka-Seltzer Gold that didn't have aspirin. It's a little bit hard to find now, but I mean, Tums. Do we consider that a supplement?
I mean, melatonin, turmeric. We're going to talk about the study on turmeric. Aloe for sure.
Mm-hmm.
I mean, slippery elm is just part of the, the
Totally.
cocktail
Marshmallow
that's,
althea, yeah.
yeah.
Yep.
I think
Yeah,
of
any
those more as,
demulcent herb.
right,
And then carminatives, like the whole huge category of carminatives.
Yep.
bitters.
Yep. And then, okay, one that can go really, really well or can go really, really bad is peppermint.
Hmm.
For
Yep.
some people, it's magic, and for other people, it's torture.
I mean, it seems like, yeah, it seems like a simple topic, but it's not at all, because it
No.
depends, the agent we're gonna use, it's not like the few pharmaceuticals that we can pick from. It's like, okay, are we going for acute symptomatic relief with the meal? Are we going for healing of the tissue? Are we going for
Mhm.
motility? It's, a lot for some of our brains to handle, so.
And then
Alana, oh, go ahead.
hydrochloric acid and pepsin.
Yeah,
Okay,
that's a mixed
I
bag.
would like to tell a
Wait.
story. Go on, finish your question. I'd like to tell a story, but you
I
go.
have a question, Alana. So I know as your resident, you were always telling me to try the peppermint drops, like
Mhm.
peppermint tincture in a little water before meals, and it always freaked me out because I was afraid of, like, you would even tell me to do it in the case of heartburn.
Mhm.
Patients were having heartburn. I was like, what the heck? That lowers the esophageal sphincter. It took me
Mhm.
a long time to try, and it is an absolute home run with some people. Some people it totally makes it
Yep.
worse.
Yep.
Have you made any rhyme or reason on like who would be a good candidate for trying it, or is it just totally random? Give it a
Yeah.
shot.
So I think that there are these two. Okay, so if you look at the literature, and I haven't looked in a long time, but if you look at the literature, there's one clear theory in the literature that basically says it's due to lax tone of the esophageal sphincter. You know what I mean? Like all reflux cases are due to lax tone of the esophageal sphincter, which I think is that definitely bears water in the literature. Does it bear water in our patient population? Not necessarily. Like there's a lot
Yeah,
of
I don't
different
think
things that
so.
could be causing the symptoms. And so if it's not caused by the weak lower esophageal sphincter tone, then peppermint would actually like help things move down and get things out of the stomach. So if it's caused by like the stomach having a slower gastric emptying, the peppermint is exceptionally effective. But if it's
Yeah.
due to low sphincter tone, the peppermint is going to be your worst enemy.
Yeah.
Right,
So
and so,
I think I'm seeing it where I'm concerned more about like SIBO or some kind of, intra-abdominal pressure again, pushing upward, where we're getting the benefits of it as an analgesic, as a carminative, peppermint, especially if it goes down where you can taste it, not just enteric coated.
Yeah.
I do see really help.
I
yeah,
will also say that it is terrible tasting. I mean, like when we're
Yeah.
basically using the essential oil of peppermint, right? It is
Hmm.
so strong. It tastes
Yep.
bad. And every time one of my kids have a tummy ache, like, I kind of think at some point we should do an episode just like, what do we feed? What are the things that we use for our children? You know what I mean? Because that's like,
Yeah.
that's kind of the stuff that's like, we're not messing around because we're giving it to our most, vulnerable people in our lives.
Hmm.
But when my daughter has either nausea or a tummy ache, I give her a homeopathic basically digestive stimulant, and I give her peppermint. Uh, and that will calm. She will usually either belch or have a big bowel movement, and then her stomach will feel better 80 to 85% of the time.
yeah, I mean, I think because
Oh,
of the research on using it with IBS and like people with bloating and other things, if like Dr. Sand was saying, if there's an intra-abdominal pressure issue, it makes sense if that's what's causing the reflux that it would work. And, I haven't used it for this indication, but I had it was called peppermint wow drops, and they didn't
Ooh.
taste that bad. You can literally put like a drop and like on your tongue or however you want to take it. But it was pure, I mean, it was pure food grade peppermint
What can you
oil.
give me a decade? What decade were you taking the peppermint
It's
wow
a good
drops?
question. That was in around 2001. I
Okay.
think
wait.
it's still
So
around. A friend asked me what it was because she needed it
And it's still
for,
here?
I think she ordered it. I mean, I told her the name and I think she got the same one.
is it peppermint oil or peppermint tincture? Because aren't the herb farm peppermint spirits, aren't those tincture, not
I,
oil?
I thought it was essential oil. I don't know. Let's go see.
I thought so
Yeah.
too. The one I had used, I thought it was just peppermint oil drops, food
You thought it
grade.
was tincture?
No, no, not tincture.
I
Let's
think
see.
I
But
thought it was, but I don't remember.
yeah, I'll look too to see if the one from the early part of the century is still around.
Yeah, that's funny. Because you're not even being facetious. It literally
Nope.
was the early part of the century.
Well, yeah, they're still around. It's called Wow Drops. it's basically, let's see. You can all look it up, but it's
So
basically,
it's basically,
it's not telling me the ingredients right this second, but I think it's just peppermint oil. That's food grade.
so Dr. Sand, both of us are correct. It is
Yeah.
leaf extract and essential oil.
Okay, so this
Yeah.
one is pure peppermint oil and chlorophyll. And it's being sold as a breath freshener.
Oh, but it works to calm. I mean, I do
Yeah.
think that's probably the differential, is that intra-abdominal pressure. Like,
Yes,
is
I
there
think
something else
so.
that's going on that makes it more doable?
Right.
So yeah, so this one, as you just looked up, it is a very potent. It's a 79 to 89% alcohol extraction. So
Yeah.
that, I imagine, is making it like not only potent, but like the bitters are coming
I
out
mean,
then too. And it is
like
Herb Farm makes some good stuff though.
yeah,
I have to say.
it
Maybe
doesn't
that's supposed
taste.
to be in water. Maybe
It
you're
is.
supposed to
It is,
take that one,
and
right?
it's really,
Okay.
really
Yeah, for
interesting. It will
sure.
make the water cloudy.
Huh.
It'll
Yeah,
make the water
it's
cloudy.
cool.
Yeah. It really, it is like very effective. That's one that I
Yeah.
swear by. Okay, but one of mine, if we're still popcorning, let's do melatonin. Melatonin actually has some pretty significant data for decreasing GERD.
So not
Uh-huh.
at the time of symptoms, you mean as a regular ongoing treatment protocol?
Yes.
Okay.
And why? Why would melatonin work? Does anybody have any theories?
It's an
Serotonin?
anti-inflammatory and antioxidant. I just learned in a conference a couple weeks ago that it's 5 times as potent as vitamin C as an antioxidant.
In
So it's
fact,
probably going to help heal too.
exactly. That's exactly
Yep.
what it's going to do. And so there is this trial that was limited to GERD, 176 patients were either given melatonin with a couple of other nutrient compounds, especially B6 and B12, and then, or omeprazole. And it found, hold on, treatment effect was measured by the length of time they became to become asymptomatic. 90% of patients taking the nutrient combination had experienced relief within 7 days, while 66% of those taking the omeprazole had relief after 9 days. And then after 40 days, 100% of the patients on the melatonin nutrient composition were showing relief.
Okay, I was thinking maybe it had some effect on the serotonin pathway and
I'm
motility.
sure, I think it's anti-inflammatory. I'm sure it has some effect on the melatonin pathway. I also think that sleep, when you sleep, you actually heal. And so
Sure.
then you're utilizing your natural mechanisms to heal up your tissue. So melatonin
It's
is
also
Mhm.
anti-neoplastic. And I thought, so if we are looking at anything like Barrett C, I would consider that.
Yeah.
But isn't it like very mildly prokinetic, or am I making that up somewhere? I thought I heard that.
I don't know of it
Maybe
directly, but again, with this like serotonin pathway, I wonder,
Yeah, exactly. I think I heard that somewhere, but don't
quote you
fact
on
check
it.
me, or maybe do fact check me on that.
So what kind of GERD, I guess, subdivision would you consider trying melatonin with?
Esophagitis. Someone who has ulcers or esophagitis. That's when I would use melatonin.
Okay.
And not low
Any
doses.
kind of inflammation.
6 milligrams is what the study was using.
Okay.
And I used to use this Lynn Patrick protocol. I used to use it, so the whole protocol, let me just read it off. Melatonin 6 milligrams, tryptophan 200 milligrams, vitamin B12 50 micrograms, methionine 100 milligrams, betaine 100 milligrams, folic acid 10 milligrams, and B6 25 milligrams. And so forever, when I was tapering my patients off of PPIs, because that's the thing about PPI is they get started and they never come off. When I was tapering my patients off of the PPIs, I would have them like get a hodgepodge of all of these nutrients. It was like, I'd send them home with like 5 bottles to try to get this to match this formula. And that would be like, as they very slowly taper down, we would use this protocol to kind of like let the transition be a little bit easier. And then there was this magical thing that happened, that a supplement company actually came out with this product with everything in there. And so then it was like, I could send my patients home with 1 bottle. But then, of course, the supplement company discontinued making this blend. And so now I'm back to the 100 bottles again, which is a bummer.
Sounds like a good idea for a product.
Yeah.
I know, add it to our list here of supplements we should start.
Yeah.
I hear it's a booming business.
Okay, let's talk about some of the other ones we popcorned.
I mean, DGL was always my go-to for people for acute symptomatic treatment instead of taking if they didn't tolerate or didn't want to do a pharmaceutical before meals, right? So it comes in a powder, it comes in a chewable. The chewable usually has xylitol and other things that I don't love for people with gut stuff. So I'd usually have them do the powder's not super convenient, but it's not that hard. So I'd have them do that. And I feel like it worked for a majority of people for symptomatic treatment when I wasn't worried about ulcers and it wasn't, they already usually had an EGD, and we were just trying to give them some symptomatic relief while we were working on other things. It worked quite well.
I mean, I would also use it for people with ulcers.
Yeah, for healing, right?
Yeah. There used to be this great chewable licorice product. We used to call it dessert.
I don't think
It
I
was just
tried
like
it.
chocolate dessert.
I think
I
I was
remember
usually,
that one.
yeah, I think I was usually like, why are we stocking this? It has weird ingredients.
Really, that's
And you
funny.
guys were like, great, this is a chewable.
I was like, oh,
It's
let's go.
medicine.
I'm hungry. I need my sweet treat. Let me just go to the cabinet for the testers and grab a little chewable.
Oh my gosh. Oh my gosh. I think I mentioned it before, but I see DGL as like get the chewables, but have patients suck on it as a lozenge for nausea.
That's a little trick that I use for chronic cough. Like an
Oh
MCAS
yeah,
cough or a
totally.
histamine cough, just suck on it
Yep.
and that will just like soothe the back of the throat.
Yep. Yeah, it's great.
Okay, should we do D-limonene? Limonene?
Yeah, limonene, I don't know. Citrus feel.
Limonene, I feel like I can get my lips behind.
I feel like it was
It's
limonene, but I
Oh.
don't know.
It's limonene or limonene. One
You
of
know
the
what I
two.
always say? Just say it with confidence.
Yeah. So giant horse pill. Do you guys see it work?
I've never used that with anyone. I mean, I've read about it as a motility agent, but I've never actually tried it with anyone.
I think the studies on it they're not very robust, but it's always one that I'd like to try. The other thing that I'd like to try is actually lemon peels. Like we're talking about like podunk old naturopathic remedies, which is I think how limonene, I'm going to say it with confidence, D-limonene got started was because if you actually chew lemon peel after a meal, that could actually prevent your reflux from ever starting. The essential oils of the citrus plus the bitterness of the pith will really just like in Chinese medicine, we just call it like it'll descend the qi. And what reflux is in Chinese medicine is a reverse counterflow qi. You know what I mean? Like it's going up when it should be going down.
Yeah.
And so that's what I will also try is just like that old podunk lemon rind.
It's like a bitter
way
too,
cheaper.
kind of, right? Like
Way
I mean,
cheaper.
it's
Totally bitter.
Yeah.
Okay, so have you heard of this trend on the internet with citrus? Like it's supposed to instantly induce a bowel movement. And I'm curious if any of you have tried it, but I'm guessing not because you're like
I try to stay off the internet because of these types of things.
Me too.
I
Did you
like,
try it?
I guess the social media knows my interest
Algorithm.
here, but this is what it is. So you get a slice of orange, and then you pour like cayenne and cinnamon on it, so it's like covered.
Oh, okay.
And then you eat the whole thing, and the peel is like the most important part. And they say that it has these essential oils and whatever. They're supposed to get you to poop like immediately.
And not vomit. It's not trying to get you to vomit immediately.
Yeah. It clears your parasites, it gets your toxins out. Yeah. I don't know, but they're saying like a key of it is ingesting the peel.
The rind. Yeah.
Or
well,
the
that
bitter
sounds like
essential oil.
There was that thing like years ago that people were doing called the master cleanse, which was like
that's not years ago. That's decades ago, and that is old naturopathic medicine at its best.
Is it?
Yes.
Okay, so it was based in actual. Okay.
Oh yeah.
Because I mean, they talk about lemon, like warm lemon water and
lemon water, honey, and citrus.
Okay, well,
Good
they like marketed it as this whole detox protocol. You know, it sounds kind of like that.
So that is definitely a thing that is very, very useful for a certain subset of patients, but very, very difficult. Yeah. Okay, can I tell you guys about this very
I don't recommend this cleanse.
I think under supervision actually it could be very useful, to be honest.
All right, well, I don't know. I have mixed feelings about it.
We got a skeptic here.
It's also not good for your teeth.
I'm sure it's not good for your teeth. That's true. Yeah. That's true. So I went in January. I attended, one of my favorite conferences, one of my favorite naturopathic conferences, which we all need to go to. It's in Hawaii called Hawaii Doc Talks.
It's the best.
It's the best. I mean, first of all, it's a conference in Hawaii that only goes for half a day. I mean, come on. Okay, so I attended, and one of the speakers was this physician, this naturopath, who was like a naturopath in every form of the word. You know, like she was trained in like the 70s or 80s, like she was podunk. And she did this whole talk on hydrochloric acid. Right. Or she kept on coming back to hydrochloric acid, hydrochloric acid. And, you know, I've been at medicine long enough and I've trained enough, you know, physicians. So I go through these waves of like believing what I know to be 100% true no matter what, and then knowing something else and believing that to be 100% true no matter what. And I went through this whole phase on hydrochloric acid because at the end of the day, when I look for hydrochloric acid and I look for the data, the only data about any kind of achlorhydria is in somebody with some kind of anatomical alteration, some kind of surgery, some kind of resection. You know what I mean? Like nobody's looking at achlorhydria from the perspective of just regular human beings, right? Nobody's going to study that. I mean, with all honesty, there's literally no money in it. But so I was like, you know, hydrochloric acid, I just don't buy it. And then I went to go listen to this doctor talk, and she was like, that's a hydrochloric acid problem. If you see this conglomeration, that's a hydrochloric acid problem. And at the same exact time, I had 2 or 3 patients come into my office, right, like pretty close to each other, and they all came in with chronic reflux. And on their own, because of the internet, they were like, well, the YouTube or TikTok told me that I need to take hydrochloric acid. And I started taking it, and my intractable reflux went away. And the presentation was all exactly the same. They went to see their gastro or their primary put them on some kind of PPI. They did not respond to the PPI or became worse. And so on their own, they discovered hydrochloric acid, and it completely changed their reflux symptom presentation.
What was
I
the
guess
demographic of these patients?
All over the place. One was a retired female in her 60s. One was a very, very young man in his like early 30s.
Huh.
One was a female who was like middle 40s, all over the place.
yeah, I mean, I would say I'm not saying it's wrong. I'm not a fan of giving that directly. I think unless they have documented hypochlorhydria or achlorhydria, there is a Heidelberg capsule test that there's several clinics in the Pacific Northwest that still do. But I feel like we could give some raw materials and or cofactors like zinc or bitters, etc. Again, I'm not saying it's
Okay, so
wrong. It's
can you chunk out exactly what you said? Because lots of people are going to get lost right there.
okay, so zinc, I believe you need zinc to make hydrochloric acid. So if they're low in zinc and you can check that on a blood test, that could help boost up their hydrochloric acid, what their normal production of it. You know, if they're eating in a stressed manner, of course, you're not going to produce adequate hydrochloric acid. And then I would prefer to give bitters or just sort of like we've talked about, the sort of bitter sprays, those types of things to naturally induce the whole pathway as opposed to giving hydrochloric acid. I just worry about potential negative side effects of doing that, especially
Like
when
what? Like
I
what?
mean, we can't monitor. Has there been studies? Can it cause esophagitis? Can it cause erosions? Can it cause ulcers on its own without other, you know, are they taking NSAIDs sometimes and not telling you, you know what I mean? Like, are they
Yeah.
older? Do they have friable tissue? I don't know that I've seen, like you said, any actual data on using it outside of sort of passed along the way, like try
Yeah.
this with people and do this, you know, so
I
yeah,
think
yeah.
like I've had a lot of patients come in and report benefit from it too. I'm reluctant to give it too often to folks. But I think the thing that's really dangerous is when people find that protocol where you're supposed to take it till you feel the burn, and they're taking like half a bottle in a day. Like that is not
So
okay.
can you chunk out that protocol, and then let's break it down. Yeah.
Yeah. So I mean, I haven't done one, and I haven't really read through them, but it's something along the lines of you're supposed to take it with meals or after meals or something. And you keep increasing the dose until you feel the burn. Like you get some feedback from your stomach that is too much or sufficient or whatever, and that's your dose. And you may have achlorhydria or hypochlorhydria if you have to take a high dose. The problem is our innervation in our gut is very varied. And some people really can sense things and some people really can't sense things. And that is not a useful help. It's a dangerous metric to be using for literally dosing acid, not the fun
right.
acid, but just acid.
And I feel like if there was a good clinical, you know, if there was research and clinical data on it, like we do have companies that are making pancreatic enzymes and patenting it. So it's not like
Except
it can't.
all of the enzyme studies are done via big pharma because they're also making proteolytic enzymes.
Sure, but
Yeah.
couldn't they also make their version of hydrochloric acid? You know what I mean? Like, why would they not?
Yeah.
patent that and sell it if they're doing that with pancreatic enzymes, you know, because you can buy them as a supplement, but we've talked about the pharmaceutical options as well. So I don't know that that's a good reason for there being not research on it, you know?
Right, right.
So, Alana, how are you using it clinically now that you've changed your mind?
So I think I'm looking for that subset of patients who get worse with PPIs. Like that's often where I'm going to start by trying. And I also I am very concerned about that protocol. Like if you go back, one of our colleagues was like explaining to us, she's been around since the 80s. I think she got her training in the 80s. And she was telling us how that protocol came to be. And it was just like some guy who was selling supplements. Like it wasn't a physician. There was no research behind it. He was like, take one more, you know, if it doesn't burn. And then once you get burned, come down. So I'm not doing that, but I'll take.
Good marketing for supplements. Just keep taking it. You're fine. Don't
a half
worry
a
about
bottle.
it.
That's your therapeutic dose.
Yeah,
Absolutely.
keep it up. Keep drinking.
So I will, if I have that conglomerate of patients who do worse on the PPIs, then I will often at that point try, you know, a couple of pills with meals. And, you know, there's a couple of good products. I generally like hydrochloric acid with pepsin. Because I think that they generally travel together in the stomach. And I feel like the pepsin is what actually makes the biggest difference for like longevity. And I do feel like there is a thing with that patient constellation that sometimes they are also in need of some kind of B vitamin support. And I'm not sure how hydrochloric acid, how that factors into you absorbing your Bs, but I would imagine that it does.
Yeah. I mean, I'm curious as to why the Heidelberg test went out of favor. There's select places that still use it. I have not dug into the validity of it, but it seemed like a good way to figure out, I mean, is this actually low or high stomach acid outside of having to do an endoscopy and a pH probe and all the things? You know, it's a pretty easy test.
Yeah, I was talking to one of my colleagues who used to run them, and he was like, after running them, you know, during my residency, I don't know if I believe him.
Okay, so there's
They were
an
like
issue with
all over the
validity.
place. Yeah, and
Okay.
that was his experience.
Yeah.
Are we done with HCl?
I think we might be done with
want-
HCl. What do you want to go
Okay,
to?
we can always circle back. I want to hear about N-acetylglucosamine. I need a recap on
So
that.
I love NAG. NAG has research on a lot of different things, but basically it's one of the main constituents to build the tight junctions between cells. And it's, you know, usually it's a powder. Usually we dose it, depending on what's going on, somewhere from 750 to like 1200 milligrams multiple times a day. And it literally is just used it's mainly used for the esophagus, for the ulceration, you know, like the inflammatory process. It is just putting in that grout between the cells. That's how I always think about NAG.
So how is that different from quercetin or glutamine?
Okay, so glutamine, remember, glutamine has a preference to the small bowel. It does not have a preference to the stomach. It does not have a preference to the large intestine. Glutamine has a preference to the small intestine. Curcumin, quercetin, and vitamin E is another group of really just strong antioxidants that will also raise the level of glutathione within the tissue, and it helps basically modulate the collagen production. So it's like anti-inflammatory, anti-fibrotic effects. So it acts as an anti-inflammatory. That's how, and you know, there was this one study that was found that turmeric does help with dyspepsia. They didn't do any further evaluation, but it did improve dyspepsia.
How was it dosed?
Oh,
like a pill or like
it was a pill. No,
diet,
it was a
tincture?
pill. It was a pill, but I don't know the milligram dosage.
Okay, and was it with meals or was it sort of as needed or just like a daily get it in you?
I think it was a daily get it in.
Yeah, I would think for that indication, it's probably a daily type of thing.
Yeah. And I think the study went for like 6 or 9 weeks.
I mean, give me a reason not to give turmeric to people.
Yeah. Yeah. I mean, I feel like I'm very, very free with my turmeric, and I'm very down regulated with my curcumin. I feel like curcumin's not worth it.
Yeah.
Oh, really?
Yeah. I feel like, you know, I sat through this lecture years and years ago from the main researcher out of India. Have I told you guys the story? Do you guys know the story? The turmeric researcher?
Where did you meet the guy from India?
American Association of Naturopathic Physicians, the AMP conference. He lectured. He was the keynote speaker, and he was the guy who literally put turmeric on the map, right? He
Oh,
was the guy who was he did all the research. He found all of the active constituents of turmeric. He decided that curcumin was the most bioactive, and so he started publishing his data. And then what happened is everybody wanted curcumin. So then
got it.
India, who, ingests more turmeric than any culture on the planet, was decurcuminoiding their turmeric and then selling it to the general population as their spice minus the curcuminoids.
Oh,
And so
weird.
then what he did like 20 years later is he actually redid his entire study with curcumin-free turmeric, right? So redid the entire study, and he was like, oh, the efficacy of curcumin-free turmeric actually might be even more robust
Oh,
than the efficacy of curcumin.
that's
And
really
Wow.
interesting. Yeah,
and so
because
that
yeah.
I am like, please drink your curcumin, please put it in spices.
You mean
Please
turmeric?
your turmeric. Please drink your turmeric. Please
Okay.
put it in spices and tea blends and whatever. Please don't. Curcumin is
Okay.
so expensive.
That's good to know because I was underwhelmed with the effects of all of these fancy curcumin
They're
products that have
expensive.
been
Yeah.
sold. I just never saw them do much of anything, even the expensive ones. So, I mean, yeah, there's got to be something in the whole herb that's different than just
A
giving
lot of
that
our
extract.
plant medicine, though, I mean, that was early in naturopathic school. They were like, the plants are designed a certain way because all their constituents work synergistically together.
Yeah.
And sometimes that's super beneficial. Obviously, we have some really potent extracts that we know work very, very well, but whole plant stuff is useful a lot of the
So
time.
Yeah.
you were trained by Dr. Yarnell, is that correct?
Yeah.
Okay, so Dr. Yarnell was at Hawaii Doc Talks with me. We were both presenting, and somebody asked a question about alpha lipoic acid, and this really, like, this is another thing, like that physician talking about HCl struck a very big chord with me. Dr. Yarnell at some point was like, I'm not surprised that alpha lipoic acid has these crazy side effects. It's a drug. Like, where in nature do you find a constituent of alpha lipoic acid? You are pulling it out of something. That is a drug. And that for
Mm-hmm.
me was so interesting because a lot of our substances, we are using them as if they're natural agents, but they are on the spectrum closer to pharmaceutical sometimes.
I mean,
Mhm.
yeah, and it's really like whenever Pfizer, Bayer, whomever wants to buy them up and patent them, then yeah, they are a drug. It's
Yeah.
like how many times have we seen that happen? But it's a fine line. And shout out to Dr. Yarnell. He is brilliant.
Yeah. Yeah.
We need to clone him.
And
He's done so
honestly,
much for this
if
profession.
anybody gets a chance to hear him talk, like the way the
Do it.
conference, it was 25 minutes. You are so excited and revved about your profession after
Mhm.
that man talks. Yeah. Good.
I was so lucky to learn from him. He
Yeah.
taught a lot of our classes.
So what are you guys
Yep.
consuming your turmeric in if you're not eating curry?
I am all about in the winter,
Curry.
it's winter right now, anti-inflammatory chai.
Oh, just
Turmeric,
put it, great
ginger.
idea.
Yeah.
And I should put it in my chai mix.
I mean,
That's like a no-brainer. What have I
you're
been
the one who's
doing?
Indian. What are you doing?
It's not in the regular chai mix. I have the auntie's
Yeah.
chai mix.
It does make it much more Western. I feel like to throw in your Indian herb and not the
Oh
way it
no,
was.
I'm adding it. It's
The
very
golden
strong
chai.
though. Like it has
Yeah,
a strong
it's very
flavor if you're
with
not.
bitter.
I like
Yeah.
it. Yeah, I like it. I think it's
I
good.
like it too. I mean, in curry, it just kind of like blends in, but you have to be a little careful if you're going to put it in your chai.
Yeah.
Yeah. I like this concept of tea. I think you need fat, right? You need some fat in it.
And
Yeah.
black pepper. You need black pepper.
Yep. Yeah. I like the topic of teas because I've been getting a bunch of patients, much to my dismay lately, who can't do pills at all, which is like initially frustrating. I mean, it's not frustrating. It's just you have to think a little bit more, but then it's also kind of this cool challenge to get crafty with our herbs. And teas, I think, can be really beneficial for these upper GI symptoms because that's where we don't need to encapsulate it and get it all the way down. And I have gotten good traction with things like heartburn or nausea, any kind of like retrograde flow, like you said, using teas. I just can't dose it around meals. So I want to make sure, as we talked about, I think in episode 1 of this, heartburn series, don't dilute your stomach acid when you're trying to digest. Like let your enzymes do their thing. But outside of that, strong like throat coat type of teas with all our demulcents, I see do really good for people.
Yeah. And then honestly,
Helpful.
curries.
Yeah.
Curries are the only place you can, I mean,
Don't have to convince me.
yeah. Yeah. Okay, that
Delish.
was anything else that's outstanding that we kind of missed? I feel like that was a pretty
Well,
good
I think,
recap.
I mean, there's so many more, but we did an episode on like healing the gut mucosa.
Yeah.
So that one also, like, we pull from a lot. So if you haven't checked out that episode, go back and listen because we do cover a lot of the herbs and supplements that we shouted out in our initial popcorn. And then I do want to give a shout out to Alana's sweater today.
Yes, thank you. Thank you for bringing up my sweater.
It's
Okay.
a nice looking sweater.
So this was gifted to me by Dr. Kapadia. So last night the Turd Nerds had a meeting. We called it a retreat, but there was lots of laptops and not a lot of retreating.
There was good
Mhm.
curry though.
There
Thai
was
curry.
really good Thai curry. Yeah, that's true. Did it have turmeric though?
Mine probably did. It was a red curry. No,
Oh, yeah.
I guess Thai food, hit
Yeah.
or miss. Go on, go.
So and she bought this sweater is like a wool sweater, and I was like, it's so nice. I'm afraid to wear it because I can't wash it. And that's where I learned from Dr. Kapadi and Sand that wool doesn't get sweat. So if I'm sweaty and my underclothes are sweaty, my wool would not be sweaty, theoretically.
Well, it
Just air
just
it out.
doesn't smell. It generally doesn't retain odor.
I mean,
It's like
that's like
very antimicrobial, you know?
now I'm liberated. Now
Yeah,
I'm
so you can
warm
wear
all
it.
of the time.
Yes, you can wear it for years and not wash it
That's my
unless someone
plan.
tells you otherwise.
And my, my where I'm recording right now doesn't have great heat and it's cold, but I'm not cold because I'm wearing the sweater.
It's so warm.
It's
Yeah,
so
no, I
amazing.
love that sweater.
Yay
So
for sheep.
thank you,
Yay for
Dr.
sheep.
Cavadia. Okay, should we do Who Wants a Popcorn? Our recap. Our recap
Well,
for herbs for okay, go.
I know we're out of time, but I want to do a placeholder because you told us at the beginning to
Oh,
remind you of
right.
cases, and I am totally, I've been hanging on this clip this entire episode.
Well,
so
I ruined it for you already because this was the one I was telling you about with a hydrochloric acid and pepsin. That
Okay.
was
okay, so we kind of covered it.
yeah, we covered it.
Okay, all right. Well, then I'm off my cliff.
Okay, good.
Okay, so
Back up.
general recap, there's many non-pharmaceutical agents to help with reflux. Some of the big ones we talked about, N-acetylglucosamine, DGL, turmeric, more so than curcumin, zinc carnosine, we didn't dive into too much. And then some of the teas and such that Dr. Sand has found helpful. What did I miss?
The peppermint that is for the increased intra-abdominal pressure being the underlying cause. That one could be really helpful.
I think that's
Yeah,
most
don't
of the
forget your
ones.
foods.
And then melatonin
Oh,
for
yeah.
healing the
Oh,
inflammation.
shout out to
Yep.
melatonin.
A little bit of prokinetic, we think, maybe.
Mhm.
Okay, that was a great episode.
All right.
Yeah,
Okay, thanks everybody. Bye.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.